So you need an ADSAC assessment. What's next? Many of the people I've worked with have had little idea what to expect in an ADSAC assessment, much less what to do with the recommendations. I want to give you as much information as possible so that you can be prepared and to make this process as smooth as possible. An ADSAC assessment has 3 parts to it: the DRI or DQ, the TADS or the needs, and a biopsychosocial assessment. These assessments can be lengthy, and you can expect to be here for about 2 hours. Let me give you a little bit more information about each of these assessments. DRI stands for Driver Risk Inventory, and DQ stands for Defendant Questionnaire. These 2 evaluations are very similar, and only one is needed. The DRI is used when someone has been in trouble for driving under the influence. The DQ is used when someone has been in trouble for an alcohol or drug offense but doesn't necessarily have a DUI. These evaluations have 113 and 137 questions. However, most of these questions are true and false, and almost all of them are multiple choice. These assessments assess for various levels of risk. These different levels of risk include alcohol risk, drug risk, stress management risk, driving risk, and truthfulness. For the purpose of an ADSAC assessment, only alcohol risk, drug risk, and truthfulness are used. The other areas of risk are ignored or discarded. These evaluations have been statistically normed against the average population to give the most accurate results and best recommendations. It is one of these assessments that will be used to determine the level of treatment services recommended. It's important to note that these assessments test for truthfulness. Truthfulness is used to determine if the assessment is valid or not. To have an acceptable truthful score, it is important to have radical honesty. These assessments will ask questions like, have you ever lied? Have you ever been embarrassed about something you did? Well, we've all lied at some point, and we've all been embarrassed at some point. Anyone who says otherwise probably isn't being honest. During this assessment, you might feel pressure to present the best version of yourself. It's very important to answer truthfully and not how you think you should respond. If your truthfulness score is not acceptable, the assessment will be considered invalid and must be repeated. Next is the TADS or the needs. Nathan Ladd Evaluations only uses a TAD, and so I'm only going to discuss it. The TAD stands for Triage Assessment of Addictive Disorders. It is a 32-question structured interview that is all multiple choice. The TAD is used to determine if there's a drug use disorder, alcohol use disorder, according to the criteria of the Diagnosing and Statistics Manuals. This assessment is used to confirm the results of the DRI or DQ. Finally, there's the biopsychosocial. This is a face-to-face clinical interview conducted by an ADSAC assessor. The specific evaluation used by the assessor is up to the discretion of that professional. However, it must cover certain areas. These areas include emotional health, physical health, social and recreational well-being, vocation, and behavior. Behavior must include substance use, abuse, and dependency. The evaluation must collect sufficient information for problem formulation, intervention planning, and recommendation to substance use-related clinical and/or educational interventions. NLE uses the Addiction Severity Index, or the ASI. The ASI by itself is not sufficient for a biopsychosocial, but makes a great framework. With the addition of a few follow-up questions, it does very well as a biopsychosocial. The final step of the ADSAC assessments is recommendations for substance-related treatment. It's important to note that it's not a question of if services will be recommended, but what those services will be. The level of the recommendations varies based on the results of these assessments. For more information about the levels of treatment recommendations, you may see the video below. This is a lot to complete. That is why an assessment typically lasts about 2 hours. NLE wants to make this as fast and as speedy of a process as possible for you, but without sacrificing quality or reliability. We want you to get the right results the first time, so you'll not have to repeat this process. I hope this shed some light on what goes into an ADSAC assessment. If you're interested in an ADSAC assessment or knowing more about it, please feel free to contact us. You can find our contact information on our contact page or on the website footer below. I hope to hear from you.